Everyone. We're here again having a conversation with Dr. Noggle, and I'm Maureen Kahn, President and CEO of the Blessing Health System. And Dr. Chad Noggle is a neuropsychologist with Blessing Physician Services and part of the Blessing Health System. And Dr. Noggle, do you want to briefly explain to the folks here today, to our staff, what you do within the health system to help the staff and the people that you serve?
So here at Blessing, I serve in two main roles in many ways. I'm a board certified neuropsychologist and work with kids and adults addressing various needs along those lines. But within the realm that's relevant to dealing with COVID and coronavirus and what everybody has been going through, I'm first and foremost a psychologist. And so like any other psychologist and counselor, I work to help people recognize and avoid, different triggers that bring about anxiety, stress, depression, as well as helping those individuals, learn ways to cope with those feelings and any of those emotional and behavioral reactions.
And, during these 80, 90 days of COVID, we made together a couple of different videos. You did several to help our staff, to help their children deal with stress. And we are still seeing increasing amounts of stress during this time. Wouldn't you agree that it's still there?
Oh, most definitely. And in some ways it's changed and even increased. I think at this juncture we have an intermixing of many different variables that is bringing that stress to a head. You have those individuals who are still having those same worries and concerns about the virus itself. You have now some individuals who are facing financial stressors that were not necessarily there at the outset because of reduced work time. Some individuals who have lost their jobs. And then you have some of the more regional and global concerns individuals have in terms of the damage that has occurred to the economy. What does that mean for the months and years ahead? And there's frustrations because different individuals have different views about how various things are handled in our economy and in our government and our political spectrum. And so there's some that have concerns and frustrations with how stay-at-home orders have even taken place. So you've got this culmination of everything that is kind of built into one another and increase that anxiety and stress.
But, another issue that is surfacing today is wearing masks. Yeah. And people are being challenged about, we've got to go out today and we've got to wear masks. And all of us have to wear a mask today in the hospital. And if we go out in public, we have to wear a mask. If we can't keep our 6 feet of distance and or if we're in a larger crowd. I don't know what you're hearing, if there's any suggestions you can give to people, because some people are getting mad about this.
Yeah, I think part of it, it's one of those situations within the realm of psychology that we look at where I think part of it being a hot button issue is because the mask wearing and safety measures have had such a variable response because these matters have been conflated with political beliefs and political values and where people stand along those lines. So there's definitely been, I think, an approach to that that has been born out of some of those dynamics. The truth is that we see those inconsistencies across places. I see them in my personal and professional life. And we even see differences across areas and regions. The reality is the way I operate is that most definitely at Blessing, employees are required to wear masks. Patients and visitors are required to wear masks. And the proper behavior for anyone, I think, is to be observant of the face mask rules of the business that you are in, including if you are working there. The easiest thing to do is to follow those things. The reality is businesses can request individuals to leave. They can require individuals to adhere to those rules. and they can also are required to make accommodations. Some individuals will raise concerns about medical complications if they have breathing issues. Businesses have to make those accommodations for individuals. So I think that the reason it's such a hot button topic is because it's kind of been conflated with some of those political undercurrents.
Thank you. Yeah, I don't think any of us ever like to be told what we have to do. You know, sometimes it just gets us, gets the hair on the back of our necks to go up. And I think we have to realize that sometimes we're trying to say, how are we protecting ourselves and others? And that it's not that we're trying to make it difficult, but let's try and comply with the rules. And if we have a medical reason why we can't do something, then let's make the reasonable accommodation for that individual, and let's try and help them get through it. And, I try and tell people, have fun with your mask. Put a smile on it, make a happy face on it. Let's have fun with it when you can. We are, healthcare leaders in this community, and we are the people who set an example. And, when we go into the grocery stores and we go into any of the shops, we should be the people wearing the masks and setting the example so that the community can see that we do follow the rules. No matter if we like it or not, we should be doing it. And so that our kids can see it and that the other community members can see that we will do this. And when the time is right and we don't have to do this, then we can all stop together. But we want to make sure that we can promote the health and well-being of this community. We still know that there is disease out there, and we're fortunate that this community did not get hit like other areas of the state.
Oh, most definitely. Healthcare is one of those fields where even when you're not physically at work, you are still connected to the field. When I leave here this evening, I am still a representative of Blessing Health System to the community and anyone I encounter. So, being part of this field does not begin and end with, swiping your badge or the stamp of a time clock. It's an ongoing role and responsibility, and it's being in that role model position, especially when we're talking about how to react to a disease or to a virus. They're looking to healthcare workers to be the role models, and we all who work here fall in line like that. So it's not just here. It's when you're at if you're, like you said, going in a store, visiting the post office. People know this is a tight-knit community. People know who those of us who work for Blessing, they are going to be looking towards us. And the true meaning of human connection is that it helps improve our community, but it helps. What we're doing is we're leading by example. So you can say a whole slew of things, all of us can. Actions always speak louder than words, and so we have to understand that we are in that role model position. So the biggest key is to just know that and do the right thing. It's not just about each one of us individually, it's about the health system and it's about the community. So social distance, wear your mask, wash your hands, don't host or attend events that are extending beyond the allotted number of attendees, and just be kind and considerate to individuals. Everyone is struggling, but we here at Blessing can be those role models and those beacons of hope, and contribute that positive thinking back into the community, because we've been talking so much about the spread of virus from a negative standpoint, but when you are demonstrating those positive behaviors, those proactive behaviors, and leading by example, that is contagious just as much. And that is what we need to heal the community at this time.
Yeah, what great thoughts. You never really think about hope being that contagious, and it is. And that's what people need, is to be able to feel that sense of hope and optimism out in our community, and we want it to be that contagious. Well, it's always great to talk with you, Dr.
You as
Noggle.
well.
It's a
You as well.
pleasure, and I enjoy working with you every day. And thank you for what you do and the contributions that you make to the community. So have a great rest of your day.
All right. Thank you so much.
Thank
Take care.
you. Bye-bye.